So we had very diverse topics presented here, and I don't know what I'm going to do at the panel, but now one thing I was thinking about when you say AI or in general technology for healthcare. Uh, there is of course the blue sky thing. You start personalized medicine or wonder materials or whatever that helps healthcare. This is for first world or beyond first world also. How to make things more effective in the current system. How do you have better data tracking for healthcare or have better robots or whatever. And third is of course the real social angle where things that are people who are not served by current methods very well. I mean, especially in India, you would see. I mean, I can see some of you, even though you are from US, you have been studying India. So one common theme in many of these were the community aspect, or having peers, understanding the community, understanding the peers, the peer relationship, etc., which is a challenge in India by itself, because especially if you're looking at the underserved, the rural and the poor population, the finding the who is the influential and how influence spreads. There are all kinds of angles. There's gender angle, there's economic class angle, there is maybe caste angle. And what I was intrigued by Kriti's question. There is also a lot of free advice which are contradictory given out by everybody in the society. These medicines are not good, English medicines are bad, these medicines are good, and so on. So there is a whole lot of phenomena. How do we understand these things? And any suggestions on that? Any comments on that? These are the kind of things that I wanted to, and especially it's been proven. You also said that the intervention at the right level, right, like maternal health or getting the women to understand things has a bigger impact on everywhere. It's proven if you have women literacy affects overall literacy, because if the mother is literate, the children will definitely be literate, and it's rare that. So some people are more important. So how do you understand these dynamics within the Indian context a little bit more, which may be different from others? If some of you have some comments on that, you can start because you've been doing this in India.
Okay. So yeah, in one of the I4D model that I just talked about, so we're building a network of hospitals, medical service providers in the geographies that you're working in. And one of the ways we are doing that is, so we listed all the hospitals and all the shops that we work, and all the medical shops, pharmacy shops. And so every time a member goes to one of these shops, we get feedback from that member. How was the shop? How was the experience? Would you recommend it to someone else? And based on that, there's a continuous feedback and rating mechanism that builds up. And then we have mechanism of blacklisting of someone. We have mechanisms of prioritizing to go where to go. So this is how we are building a trusted source of pool of health providers.
How to build a social network that is more relevant, say, in an environment like India.
I think one of the things that's really important that you mentioned was to incorporate the cultural and on the ground demographics, which we tried to do in our model of TB epidemiology. And so that was partially just getting the demographics right, getting the connection between people and getting real data, but also to realize that a lot of the human behavior would influence the success of the program. And we tried to incorporate that into our model by looking at the different, for instance, for different treatment patterns that people had. So we really struggled with how to model, for instance, private clinics as opposed to government-sponsored clinics, because those are there's much less oversight, and it's hard to track people as they go around to different types of private TB clinics, and that was something that we definitely took into account just in India, not for other types of TB modeling in other countries. So it's very context specific in that sense.
So I come from design department, and I'm very major advocate of the design processes that we follow, specifically in the context where we don't really know who our users are, right? So we have this method called participatory design or human-centered design, where it's not just about understanding what are the problems the users have, but what are the typical behavior in terms of socio-cultural behavior or technological behavior that the users would have. And then designing solutions accordingly, which generally we have seen that finding a large set of acceptance among users, because you know that if the users do not really know how to use a mobile phone or say even a feature phone, so in such kind of context, does a mobile application make any sense? So then how do we really incorporate such technologies and behavioral aspects of the users into your final solution that eventually it is accepted and finally it creates an impact? Something that, given that we have a technology crowd, core technology crowd, I'm certainly mentioning that the participatory design or human-centered design has a huge impact on how, instead of, what my opinion is, instead of conducting a evaluation and seeing whether it works or not, a prior process of understanding the users and designing according to them is something that has seen proven a lot effective in our cases.
So, I mean, going back to your question about how do you design social networks that are more context specific to India, I would say that, I mean, cultural norms dictate, I mean, so influence spread models that would work well in America may or may not work well here. I mean, one thing that I can think of right off the top of my head is that in India, neighborhoods are very important. When you face trouble, you go to your neighbors and you ask them for help, and so therefore, uh, those edges, if you think of them as edges in the social network, those edges would have more weight that more of, I mean, it's more likely that you will be influenced by your neighbor on a daily basis as opposed to somebody else who might be, and so these kind of context specific things can be utilized. They can make the models more context specific, more elaborate, and yeah, they can definitely play a role in sort of making the influence spread much more effective in an Indian context or any context in general. Yeah.
So we should be employing more Indian sociologists to understand the, I mean,
Definitely.
people who study specifically especially, I mean, you're probably still talking about the urban more, I mean, in the rural it probably even very different.
Definitely, yeah.
So even one of the startups which recently had, this is a simple startup, Uber for mini buses for commute in Hyderabad. This thing also called commute. And one of the findings they found, I mean, they realized that bulk of the passengers who use it are women, because the public transport safety issues are far more important for women than for men in any city. So this is an unintended discovery with this surprise discovery.
Yeah.
So if you have another question or with this thing is, if you have a limited amount, I mean, there are thousands of problems in a place like India or many countries like India. If you have a limited resource, which we all have, how do we increase the awareness and access? I mean, that is I mean, when you are healthy, there's more productivity for the country, for everybody. So what is the best way to give the resources for awareness spreading of very common things? This would be, to me, this would be a high priority, because if people get aware, they take action.
You're saying how should we spread awareness?
Yes. Or what is the spread? Not how you spread awareness, but what's the mix of, say, spreading awareness versus actual prevention? The preventive kind of step.
Okay. I think, I mean, so my point of view is that it just can't, I mean, just spreading information on a distributed sort of a level, you tell people and then you tell people, that itself won't help. There has to be government impetus as well I mean, if you want healthy sanitation. So, for example, if you spread information about, you should be using toilets on a regular basis, but the government is not building enough toilets, I mean, what do you do? I mean, so there has to be a mix and match of,
Intervention and
yeah,
and awareness.
awareness spreading. Yeah.
Somebody else has any?
We also need to look at the difference between awareness spreading and reinforcement of behavior, right? There's classic sociological theory which says that simple contagion, which is like awareness spreading, and complex contagion, which is what is needed to change behavior, to actually, cause prevention, impact prevention, you need different kinds of resources or different kinds of network mechanisms. So if you just wanted to spread awareness, a diffusion model would work. But if you wanted to change behavior, you would need to reinforce that behavior through multiple people or multiple, networks. So it cannot just be the simple act of, hey, I'm going to talk to you about maybe washing your hands. You would have to have enough people who are going to role model that behavior, which would lead to that complex contagion. So you have to design your interventions accordingly. So I guess, in terms of designing interventions, you have to keep that in mind.
Yeah, I think this is something we've seen like in the HIV work, right, where Milind mentioned how we're thinking about different models of influence spread. The sort of just like passive like information just sort of like spreads like a virus from one person to another. This just like really isn't a particularly accurate model in these domains. When you want people engaged, you want them thinking about these issues, changing their behaviors. And so maybe just like trying to get as many people to hear something about whatever information you're spreading just isn't really a very useful thing in general, right? So the mix really has to be focused much more towards things that get people engaged in whatever sort of topic that you're interested in.
So I was going to open it up to, because there's no point in talking here itself. So please.
So yeah, I was just, there was the last question actually got me thinking. There's of course a lot of experience with trying to reduce smoking, for example, in the US. Are there lessons from that you can take of changing people's behavior, or what was learned from that, if anything?
Yeah, so I think, so I'm not like really familiar with that literature in detail, but from what I've seen, yeah, we can draw lessons, things like, sort of general guidelines like, yes, networks are important, peer influence is really important, that's sort of been very well documented in sociological public health literature on these topics. And so, and then I think this is something that's sort of interesting that we have the potential to do in these new domains, where we sort of have the collaboration, right, between the AI researchers and the social scientists, because it makes us think of sort of new questions to try to measure, right? So when we're to try to get a sort of more granular models of influence spread and better understanding of the underlying mechanisms in ways that are helpful then for optimizing preventative strategies. And these are questions that a lot of the time sort of, like Eric and Milind were saying, like neither field would really think to measure the right things on their own. And so it's something that we sort of have the potential to get into depth on now.
So I'm also not an expert in that area, but I think that for smoking, the message actually mattered. So for years, right, people have been saying that you shouldn't be smoking because it kills you. And it turns out no one cares, because it's like, oh yeah, it will kill me like in 60 years or whatever. And it turns out that if the message had been, be careful, if you start smoking, you're going to be addicted forever, and it will like be like you're in a prison, it would have been a lot more impactful, and far fewer people would have started actually smoking. So I think this, I don't really know how to put it in a different context, right? But I think the message really, like with the same amount of effort, a different message can make a significant difference.
There's also issues about, there really are normative influence changes that were tracked very very clearly within populations. They just happen on a very, very large time scale. It's not the sort of thing that happens like this, especially with behavior change. And there was a lot of structural interventions that were about laws that made it so that it was increasingly expensive to smoke. It was increasingly illegal to smoke in particular areas, all of which drove a lot of social norms that made it so that smoking was now perceived as a bad thing. And so I think that sort of the ideas of messages is a very slippery thing in behavior change. It's not always messages that are important.
Yeah, I'm definitely not saying it's the only thing that matters, for sure.
Yeah, I think the shaming worked in this case, right? With
Totally.
tobacco. It's a stigma, right, to smoke in the US. And most people quit because their friends will not approve of it. Yeah.
So speaking of smoking, for example, I feel, more than social network, what is also important is what the people who are like the companies, Philip Morris, it exited out of US, but it's creating havoc in Indonesia because the government there is not intervening. So it's not a question of network science, it's a question of like these big entities who are making big monies. So that's where the intervention has to come. I think technology, social network is not important here. The governments have to clamp. Philip Morris has to, you know. Yeah. I mean, the story of Philip Morris, Indonesia and Australia, that's a very sordid story, and that is causing the biggest impact on how much people smoke.
It has to be a combination of both, though, right? You
No,
have to.
but what is happening in Indonesia, like 6-year-olds are addicted to smoking. That is not social. I mean, that is just, you know, some big companies making huge amounts of money, and they have to be throttled. Their neck has to be held.
It's also socially acceptable for 6-year-old to smoke in it.
Exactly.
Yeah, but you know, a lot of money is made by.
We have to also make a comment about something there, that it is acceptable.
Yeah.
No, it's not acceptable, but it's just that once people get addicted, then you don't care whether it's acceptable or not. You're just addicted.
But I guess it leads to that in the first place, right? If it's acceptable, then you're going to engage in that.
So may I follow up on Sunita's point and sort of generalize it, right? I mean, it's kind of seductive for the AI people sitting here to look at form DPs and model language. But for example, take TB, right? Are you able to publish this work in a medical journal? Will the doctors take this seriously and look at this as the intervention that is really the most important to prioritize right now?
So we actually had a lot of challenges with that. We had several previous publications that were published in medical journals, and they did not emphasize the algorithmic or methods portion of it, but doctors were very interested in the outcome. So when we said something like, you want to spend a lot of money and you still want to DST people up front and still spend a lot of money on testing people unnecessarily, they're like, oh, that's crazy. But that's a result they were interested in, right? And so they were like, it doesn't matter if we don't know about POMDPs, we still care about the result.
I have a question for Phoebe, I guess, based on your work that you were talking about, how you model fairness as a parameter. One is, you talked about the fairness definition was whether that would be equal in each of the vulnerability groups. What would be some of other fairness criteria for the particular work? The second point is more of a general comment, whoever can answer is, I think we're now working on this area of intersection of a lot of different regions, a lot of different areas, and public policy ideas and people, how they perceive these things. And in terms of translating this to a general public policy audience, it wouldn't fly if I were to say that as long as you can model this as a linear parameter, fairness will be taken care of. So what would be some of these communication strategies that would be required, if anybody has any thought, because I think that's going to be central going forward. Thank you.
So your first question related to fairness. So what other fairness constraints may be relevant in this context? So that's a great question. So I think the way I would approach it is to go back to the current policy and see what attractive properties it has, if any. Hopefully it does have some, where, for example, you may have like fairness across different genders, right? Or fairness among different racial groups, etc. So these are things that one would want to investigate and definitely not lose, right, when moving to a different policy. So fairness really is up to the user to some extent to define what are based on the context what are some properties that you'd be looking at. For example, in the context of kidney transplantation, a major issue has been that there's been severe organ shortages for black people because it turns out that matching is not as good between blacks and whites, and they suffer from ESRD far more frequently than whites due to lifestyle reasons. And so fairness among different races is, of course, critical. Your other question related to how do you go back and actually explain what it means that you can express fairness constraints as linear constraints. I think basically the way I would go about it, of course, like I'm open to other suggestions, is to highlight that any constraints that would basically enforce equitable success among different groups of users, different groups of homeless youth, for example, can be taken care of. And I think this really captures the vast majority of fairness constraints that one could think of. Sorry.
Hi, so really exciting to have health and social scientists here today. Thanks for coming. I wondered if I could ask a question maybe for three of you, if any of you would like to answer, Phoebe and Namika, Z. So I think what we're all trying to do in the room is find new applications for technology to have impact beyond research. So actually impact in the real world on real people. I think that's still, in some sense, an aspirational endeavor. I don't think there's, at least in my mind, the single shining example where someone has succeeded dramatically in doing that. I think one useful thing for us to think is, what are the best examples, even more broadly, just beyond technology? What are the best examples of researchers in their home discipline bringing, their techniques and tools that has a direct social impact, around the world? And I have some examples from computer scientists. I'd really be curious, if any of you have, either now or later, are there examples in your home discipline that have inspired you, or your colleagues, your peers, going back, maybe in the distant past? Are there examples people look at where researchers, with publications and intellectual exercises, where that research process led to a big social impact? Are there things we can think about studying? How do we clone those successes? Are there things in your mind? I'm just curious.
One of the things, not my own projects, but some of the work that I did with my advisor when I was in graduate school was that she worked a lot with, in the US, with various governmental programs like the CDC or to a more limited extent the WHO, and working with programs. And since they had interventional arms, it was much easier to influence policy in that sense. So they would do the model, they would solve the model, there would be interesting technological contributions that they could publish, but in the end, maybe the models were simplified and then pushed out to these arms that could actually use them on the ground and do this iteration, which I think a lot of the work around here with Milind and Eric have also been endeavoring to do, but that's I think a good mechanism by which we can translate this sort of more academic stuff into real world impact.
Milind gets the last word, and I think that we're beyond time.
So I feel the question that Shivram you asked, and the question that was asked, the comment that Bill made. I mean, these are all really important things that we need to discuss here. The science that gets generated in this interdisciplinary context is neither publishable in AI sometimes, nor in say social science, because it's at this intersection where AI people think there's not enough AI, and the other people think there's not enough other science. And so this is the struggle, I think, for AI for social good, is to come up with a new venue where this kind of work is encouraged and really publishable, for example. And I guess with respect to Bill, I mean, this is really a terrific question with respect to how to take this research. And I don't think we as professors or researchers are equipped really to push this research out. There needs to be a different mechanism, a social entrepreneurship mechanism, or some other mechanism by which this research can get translated. It's really difficult. I don't think we have the right skill set to really do that, the right capital, et cetera, et cetera. And I applaud your question. I mean, it's exactly the right question to ask.
Better train them in state of art technology, right? And later they might join a company or a startup. Right? I mean, this is a question I have struggled with all my life, and I find that I'm being unfair. I'm not being good for my students if I make them do my team project at my middle age. I feel I want to do social good, but then my students might be cheated, right?
Well, and if I can just work. Just to follow up, I guess we can learn from other disciplines. So we work with applied economists, and often what you see that they have an academic, they publish academic papers, but they work with government agencies, they advise the government, they work with NGOs, they advise NGOs. So they have a lot of influence in the world. It's behind the scenes, you don't even know that they advise the government. they do. And so I think that's a role we can take on. And we're not used to in computer science, but people are starting to do that, basically become involved in other organizations, have influence that way. So we don't have to do it ourselves. We can actually advise them.
Okay, thank you. I think we have the coffee break to carry this conversation forward. There are too many topics to discuss actually in this. Thank you very much.